Achilles tendinitis is an orthopedic disease. Look at these pictures. Calcaneum, X-ray findings, and MRI findings. Look at this. Detail going on. Introduction. Achilles tendinitis is an overuse injury of the Achilles tendon, the band of tissue connecting the calf muscles at the back of the lower leg to the heel bone. This condition is common among athletes and people who engage in activities that place repetitive strain on this tendon, such as running, jumping, and dancing. Definition: Achilles tendinitis is an inflammation of the Achilles tendon, typically caused by overuse or excessive strain on the tendon, leading to pain, swelling, and impaired movement. Types: 1. Non-insertional Achilles tendinitis. This affects middle part of the tendon and is often due to repetitive strain. It commonly affects younger, active individuals. To incisional Achilles tendinitis, this type affects the lower portion of the tendon where it is attaches to the heel bone. It is more common in older individuals and may be associated with calcification or bone spur. Causes: 1. Overuse, particularly in sports or activities that place repetitive stress on the tendon, example running, jumping. 2. Sudden increases in physical activity. 3. Wearing inappropriate or unsupportive footwear. 4. Tight calf muscles which increase strain on the Achilles tendon. 5. Running on uneven surfaces. 6. Aging as the tendon becomes less flexible. Risk factors: 1. Age, more common in older adults. 2. Activity level, high impact activities, especially involving running or jumping. 3. Gender, more common in men. 4. Foot problems, flat feet or high arches. 5. Obesity, extra weight puts more stress on the tendon. 6. medical conditions such as rheumatoid arthritis, which can predispose individuals to tendon injuries. Complications: 1. Chronic pain and inflammation. 2. Tendon rupture, a tear of the tendon that may require surgical repair. 3. Limited mobility or difficulty walking. 4. Development of Achilles tendinosis, degeneration of the tendon without inflammation. Pathophysiology: Achilles tendinitis begins with micro tears in the tendon fibers due to repetitive stress. This leads to localized inflammation, cellular damage, and subsequent degeneration. If left untreated, chronic microtrauma, often from repetitive activities, can cause a buildup of scar tissue, reducing the tendon's flexibility and making it more susceptible to injury. Step-by-step pathophysiology of Achilles tendinitis. 1. Initial trigger: mechanical overload or overuse. 2. Micro tears in tendon fibers. 3. Inflammatory response. 4. Collagen breakdown and tendon degeneration. 5. Neovascularization and nerve growth. 6. Scar tissue formation and fibrosis. 7. Tendon thickening and chronic tendinosis. 8. Pain and functional limitation. The cumulative effects of inflammation, degeneration, and structural changes result in persistent pain, stiffness, and decreased range of motion. These changes make the tendon less capable of handling load, leading to pain during activities and functional limitations. Signs and symptoms: 1. Pain and stiffness along the Achilles tendon, especially in the morning or after prolonged periods of inactivity. 2. Swelling in the area surrounding the tendon. 3. Tenderness when touched. 4. Pain that worsens with activity, particularly with running or jumping. 5. Limited range of motion in the ankle. 6. A cracking sensation. may be felt when moving the tendon. A diagnosis on physical examination observing pain, swelling and stiffness around the tendon. 2. Imaging studies. A. Ultrasound to evaluate tendon thickness and any structural changes. B. X-rays to rule out classification or other bone related issues. C. MRI useful in assessing the degree of tendon damage and rule out other conditions. 3. Composone test to check for tendon rupture where squeezing the calf muscle causes movement in the foot if the tendon is intact. Nursing diagnosis on acute pain related to inflammation of the Achilles tendon. 2. Impaired physical mobility related to pain and stiffness. 3. Activity intolerance related to pain during movement. 4. Risk for impaired skin integrity related to immobility and potential use of supportive devices. Management. Medical management. A. Pain and inflammation management. 1. NSAIDs, non-steroidal anti-inflammatory drugs, medications like ibuprofen. 2. Corticosteroid injections. B. Physical therapy. 1. Stretching exercises. 2. Strengthening exercises. 3. Range of motion exercises. 4. Shock waves therapy. C. Orthotic and supportive devices. 1. Heel lifts. 2. Orthotic inserts. 3. Boots and braces. D. Surgical intervention for severe or refractory cases. 1. Debridement and tendon repair. 2. Gastrocnemius resection. 3. Tendon transfer. Nursing management. A. Pain management. 1. Cryotherapy. Apply ice packs for 15 to 20 minutes. 2. Positioning. 3. Encourage NSAID compliance. B. Activity modification and rest. Educate the patients on limiting activities that exacerbate pain. To encourage low impact activities such as swimming or cycling. See patient education. Stretching and strengthening exercises warm-up routines, and proper footwear. The prevention of recurrence. Emphasize gradual return to activity after recovery. To teach patients the importance of cross training. 3. Instruct on maintaining balanced exercise. Monitoring for complications. 1. Observation of pain levels. 2. Skin integrity. 3. Range of motion and mobility. Treatment options. First option, medications, NSAIDs for pain and inflammation management. 2. Therapy. Physical therapy is essential for promoting healing and preventing recurrence. 3. Surgical options in severe cases. A. Debridement, removal of damaged tissue from the tendon. B. Gastrocnemius recession, surgical lengthening of the calf muscles to reduce strain on the tendon. C. Tendon repair and or transfer for cases where the tendon is severely damaged or ruptured. Psychosocial medicine. 1. Frustration and anxiety. Individuals may experience frustration due to limited mobility and the long recovery process. 2. Support and encouragement should provide reassurance, support, and education about gradual activity, resumption, and compliance with treatment plans. 3. Patient education. Important to reinforce realistic recovery expectations and encourage adherence to therapy to avoid re-injury. Prevention. 1. Gradually increase activity levels and avoid sudden increases in intensity. To use proper supportive footwear, especially during sports and high impact activities. 3. Incorporate stretching exercises for the calf muscle into regular routines. 4. Cross train by alternating high impact activities with lower impact exercises like swimming or cycling. In conclusion, Achilles tendinitis is a painful and often debilitating condition resulting from overuse or repetitive stress on the Achilles tendon. Early intervention, physical therapy, and preventive strategies are essential to managing symptoms and avoiding complications such as tendon rupture. With comprehensive treatment and appropriate activity modifications, most individuals can recover fully and return to their normal routines. Thank you. Have a nice day.